All right. Hello, everybody. So in this presentation, I'm going to be talking about imposter syndrome. You might already be familiar with this term, so we're just going to get into more of the specifics of what might contribute to and maintain imposter syndrome, and then stay tuned for my next video where I'll be talking about strategies for managing imposter syndrome. So take a look at the statements on this slide and see if any of them resonate with you. Feel free to pause it. These are all common thoughts that people have when they're experiencing imposter syndrome. So, imposter syndrome is kind of that sense of being a fraud in your accomplishments or your achievements, despite evidence of your achievements, and having difficulty internalizing your success while also having a fear of being exposed for kind of who you really are. And grad school is a time where imposter syndrome is especially salient for people because it marks a point of transition in your academic career where the level of independence and responsibility you have as a student changes so drastically. You might be teaching more, you might be asked to take on other leadership roles in research. There's often a lot of pre-existing ideas of what it means to be an academic that adds pressure. There's competitive environments. You're probably getting a lot more feedback than you are used to. And so the leaky pipeline in academia can also serve as an additional adjustment or stressor. If you aren't familiar with this term, the leaky pipeline refers to the way that we tend to gradually lose more and more women, people of color, and underrepresented minorities the higher up you go in education or in leadership positions in a professional field, which can be extremely isolating or send implicit messages about who belongs in that system. So let's talk a little bit about how imposter syndrome develops, because it's not a feeling that people are just born with, and it's not something that's wrong with you, as the name might imply. Rather, it's largely shaped by environmental and social contexts, like being in a highly competitive or critical environment at home or at school. Oftentimes, the expectations that are set for individuals within this context can be tied to systemic bias, social identity, or underrepresented group membership. For example, growing up in a neighborhood or going to a school with less resources and financial constraints that limit academic opportunities, like pathways for going to college, being the first person in your family to go to college, or attending a high school where it isn't a norm to pursue higher education. So these circumstances can create an expectation that someone won't be able to succeed or isn't cut out for something like grad school despite their actual academic capabilities. For students of color, especially Black and Latina students, harmful stereotypes around academic potential, along with chronic experiences of racism from teachers or peers, can impact academic self-concept from internalizing these negative messages, even if they don't align with their true intelligence and academic potential. Young girls might have similar experiences in STEM fields due to sexism and gendered expectations. And for neurodivergent students or students with ADHD, being in school settings that inadvertently tend to cater to neurotypicality can create pressure or to mask or to work excessively to succeed academically, especially when there aren't appropriate accommodations or when the use of accommodations is stigmatized, which can make students feel academically inferior. Alternatively, families might also put extra pressure on a student to succeed. They might idealize their children's academic capabilities or create heightened expectations of what success is for the child, which can then create a feeling of failure or imposterism when they do inevitably encounter challenges or setbacks academically. And then that kind of pokes a hole in the idea that they're this perfect intellectual being. Available role models are also an important factor. If you don't see people who look like you or identify similarly to you in spaces, it can send messages about who is or who isn't good enough or smart enough, even if the causes of this lack of representation are systemic in nature. In addition to these early experiences, ongoing environmental influences can exacerbate negative self-evaluations in the present. So being in a competitive academic culture, family challenges with geographic distance, or even having kind of a feeling of survival guilt for making it out from your hometown, microaggressions from teachers and classmates, or other forms of racism, lack of diversity in the student body, thinking back to that leaky pipeline, being minoritized in your profession, for example, women of color in STEM, or even men in female-dominated disciplines like nursing. Stereotype threat can also trigger imposter syndrome when a negative stereotype about an underrepresented group is made salient. So maybe a professor makes an offhanded racist or sexist comment, which can then make minoritized students feel pressure to represent their racial group or their gender, and then act and perform in ways that challenge that stereotype, which can then create a lot of performance anxiety. And then that further instills this idea that they aren't competent or good enough to be in their program, even if they have so many academic strengths. So let's take a look at how imposter syndrome might manifest more concretely as sort of a cycle. So you're in grad school and you have this desire to succeed, but then you also, fear this failure. A student might resolve this inner conflict through their approach to work. So they might adopt an over-preparing work style by spending so much time perfecting work or completing things really early. Alternatively, it might trigger more procrastinating work styles where that pressure can really make a lot of feelings of distress and anxiety that you just want to avoid until the last minute. So when a student submits their work, there might be kind of initial feelings of relief, followed by more anticipated failure and anxiety. But then, to so no one's surprised there is success. You might get praise for your work, good feedback or a good grade. And then both the feeling of relief of turning it in and then the good feelings from achieving continue to reinforce existing work styles of over preparing or procrastinating because of their continued success. However, there is a sense of cognitive dissonance or a feeling of conflict in feeling incompetent, but then receiving recognition from work from someone else. So to resolve this dissonance, a student might toss their successes. So they might explain away what happened by saying, oh, I just got lucky, or I just worked really hard. It's not really my intelligence. My professor is just really supportive. I'm just going to fail the next time. So then the anxiety, the fear of someone finding out, it all continues and the cycle restarts. So that concludes the first video explaining imposter syndrome. So when you're ready, come and hop on over to the next video where we will talk about strategies for managing this imposter syndrome.